Good evening. Today's topic of discussion is penile fractures, but the discussion will not be centered only on this. We may raise other issues, but basically we will start with the talk on penile fractures because it by and large summarizes the diagnostic and therapeutic issues that arise from penile injuries. So there are various types of penile injuries, as you will see in the next slide. Now we can classify the penile injuries as penile fractures, which is the title of today's lecture. And next one is the penile amputation, either self-inflicted or inflicted by others. Then penetrating injuries, such as those which occur in case of blast injuries. And then penile soft tissue injuries, which can be to any tissue starting from the skin and going up to the Colles Fascia and beyond. So these are the various types. Now, you'll be wondering, why is it I'm only sticking to penile fractures? The reason is the history is unique, the presentation is unique, the incidence is low, so it often gets asked in the examinations. So therefore, I decided that we should concentrate on penile fractures and then say a few words about amputation, penetrating injuries, and the soft tissue injuries. In terms of frequency, the penile fractures are very infrequent. 1 in 175,000 cases. These are American statistics. I could not get the Indian figures because it is so infrequent that not many surgeons have seen in their lifetime experience. But it's a pathology which you should be aware of because you need to treat it very as soon as you see a case. They are caused by direct blunt trauma, such as sexual activity, the commonest method. If you see a series of cases, you will find that this to be the majority of cases. This has caused a fracture. The next point is that Tunica Albuginea ruptures due to cavernosal pressure. We will discuss this with diagrams as we move through the slides. And early diagnosis and management is mandatory. So therefore, it becomes a urological emergency. Now, the whole goal is to prevent sexual dysfunction. We do not want that this individual does not have any sexual life subsequently. So therefore, they needed to be attended very fast. Now, to understand the mechanism, the pathophysiology, etc., we need to know the penile anatomy very well. Now, these two pictures actually summarize more vascular anatomy than any other type of anatomy, but this is important for our talk today. So let's look at both these diagrams and let us look at the right diagram first, and then subsequently we can think of diagrams on the left side. So now, for example, if you see this particular diagram, what you're seeing is the two corpora cavernosa and then the corpus spongiosum. This is the spongy area, right? This particular area. And these two on either side are corpora cavernosum. And the urethra is contained in corpus spongiosum. And the cavernosal arteries, they are contained within the corpora cavernosa. And it is there, this black layer all around is Colles Fascia. In other words, all these corpora are covered by, sorry, not Colles Fascia, Tunica Albuginea. In other words, Tunica Albuginea surrounds both the cavernosa as well as spongiosum. And just outside the albuginea are very important vascular structures. What are they? If you look at the midline, it is a deep dorsal vein. And then more superficially, it is the superficial dorsal vein. And the deep and the superficial dorsal vein are separated by the Colles Fascia. So Colles Fascia is also enclosing all these corpora. And this factor is very important because if the Colles Fascia is breached, then blood and urine will find its way under the Colles Fascia and then spread upwards. I'll show you how that spread takes place later on. So these are two important venous architecture there, are separated by Colles Fascia. On either side, you have dorsal artery, nerve, and accompanying veins. And why this is important? Because either during the course of the injury or at the time of repair, you may injure them. So we do not want iatrogenic injuries. Something has occurred as a part of the basic injury, we cannot avoid that. But even if injuries do take place, it is possible to repair, particularly the neural structures. So this structure is very important for us to remember, because now I'll go in subsequent slides. I'll show you how this structure will actually impact upon the pathophysiology. The same thing is being shown on this side. This blown up diagram of the two corpora cavernosa and the spongiosa, and this here is a transverse cut, much like much like the previous one. But what you can see very clearly is that here lies the albuginea, there lies the Colles fascia, and the venous structures are separated by these structures. We're separated by these two fascia. Now, let us move on to the next slide. Now, I have just now told you uh, that I will talk about what happens just in case the Colles fascia is breached, right? So now this is what happens. Colles fascia is breached, the blood as well as urine, if it is urethra has been injured. If not, it's only the blood. That will come out and spread into the penis, into even the scrotum, and goes up. This is typically called butterfly sign, right? Butterfly sign. And this I've shown it to you earlier also in urethral injuries, if you've heard the last lecture. So this butterfly sign and this occurs. And then this is a situation where we are operating to drain the hematoma. We will talk about this particular slide later on when we talk about the treatment and operation, etc. Now, what actually happens? What is the physiology, pathophysiology? We will discuss in more detail as we come to another slide. But basically, the thing that happens is because of the process of active thrusting and encountering an obstruction, either the symphysis pubis or the perineum, that increases the pressure within the corpora cavernosa, and that that will burst the albuginea. And when the albuginea is burst, then blood, and if urethra is involved, then urine also, that will come out and that will collect under Colles fascia. And then subsequently, it can go, if Colles fascia is also breached, then in that case, it can go out in the form of leak into the under the Colles fascia, and then you get a butterfly formation. So all the points are out here. Now, urethral injury, how often does it occur? It occurs in 30% of cases, and the spongiosal injury occurs in 20% of cases. That means whenever you get a pathology like this, you should be aware that there's a possibility of urethral injury. And usually urethral injury occurs when both the corpora are affected, because there's a proximity and both the corpora are affected. Now, maybe I'll go back a bit and explain that. Say, supposing in this area, if you have a breach in the corpora here and corpora here bilaterally, then urethra tends to get involved. Unilaterally, the chances are not that high. What is the etiology? I've already mentioned about it. Sexual intercourse, both vaginal and anal intercourse, can result in this. And the reason is, as I told you, if for any reason the penis comes out and then hits against either the perineum or the symphysis pubis, then because already the pressure within the albuginea is very high, this pressure is further increased, and that results in the fracture of the uh, penis. And that happens because the Tunica Albuginea tears. I'll show you pictures of that tear later on. And it happens because Tunica Albuginea tears. This can also happen in rough masturbation, or if a sleeping person rolls over onto an erect penis, then that can also result in injury to the of the kind that we are discussing. Or